Welcome back. Throughout our lives, our hormones are constantly changing, and for women, this can lead to negative effects on our weight, energy levels, and even sexual wellness.
A few weeks ago, Molly had the chance to tour the NuFemmeRejuvenation Clinic, where they offer the latest in medical therapies to help you reach your full wellness potential.
Dr. Feliciano, you're the medical director here, one of the founding members. Why did you decide that we needed a NuFemme clinic?
Great question. A lot of these issues that women have, especially as we age, they're not really addressed, okay? Traditional medicine will deal with certain ailments and medical problems in a certain way. We really try to get to the person's own body chemistry, and there's just no places for that. So that's how NuFemme came about, and we've been doing this for a few years here now, and it's been amazing.
You mentioned body chemistry. What are some signs or symptoms that a woman's hormones might be out of balance?
There are many different signs that will tell a woman that their body's out of balance. Night sweats, fatigue, decreased ability to focus and concentrate, anxiety, depression, unwanted weight gain, sexual dysfunction, hot flashes.
So if some of those signs, symptoms exist, that may be a sign that a woman needs hormone replacement therapy, right?
Correct. As women age, their hormones decrease, okay? And it's important that that women have those replaced so that they can lead a healthier and happier life. More importantly, if you don't replace those, those will actually put you at risk for certain medical disease. So when women come here to our clinic, we sit down with them, we evaluate them, we check their hormone levels, and we have results right there on the same day.
What's exciting right now about bioidentical hormone replacement therapy?
Bioidentical hormone replacement means these are safe, natural, plant-based hormones. They're not what we refer to as synthetic hormones. We're able to replace our hormones in a very safe and natural way. So there are many ways you can do that, okay? There's creams and gels, things like that. Here at NuFemme, we specialize in what we call pellet therapy. So what I do is I take this pellet, in a very simple procedure right here in the office, there's a little numbing cream. We place this pellet right under the skin. You don't know it's there, you don't realize it's there. Then it gets your hormone levels up to what we call an optimal level, or where they should be at, and that will last about 3 to 6 months. We do it right here in the office. It's very painless and safe, and people really love it. We also do some aesthetics as well, focusing on what we call platelet-rich plasma, PRP. We also do things like Botox and fillers. So we have a wide variety of services that we offer here.
Who's a typical, if there is one, patient of NuFemme?
Well, good question, because there is no typical patient. Everyone's a little different. But yes, we get a lot of women who are perimenopausal and postmenopausal. That's kind of our bread and butter here at our practice. But again, we also have some young patients coming in who are looking for help as well. The transformation that we see here is pretty incredible, and one of the main things we hear here is they never want to go back to the way they were. They can't imagine living with those symptoms and medical problems that they did, and so it becomes a thing of the past. It truly does.
It really is truly the new you.
It is, and we see it every day.
Let's talk about the medically supervised weight loss plan that you offer here. Why is this an important part of your overall practice?
Sure. So the majority of women, as they go through perimenopause and kind of round the bend and go through menopause, have a lot of changes in their body composition. I think we talked a little bit earlier about how, you know, hormones are the basis, and as your hormones become imbalanced, just through natural changes of life, most of the time women put on weight, or they have trouble maintaining muscle or energy or exercise tolerance, and they can't keep up with their kids, their grandkids, their work. They're falling asleep as soon as they get home and sit on the couch. So it's a huge part of the functionality of your life. So it's kind of a natural step with hormone balance. We focus very much on making patients healthy and making them have the best metabolism they can have, the best energy they can have. And we use the word body composition a lot because weight is just a number.
How is it that you help them lose weight? How does the program work?
Sure. So the vast majority of our women have never been in a program like ours because they go and they try to employ the help of other specialists that really work kind of on the superficial stuff. How I eat, how I move, supplements, nutrition, and those are all very important. But if you don't have that foundation of hormone balance, you can lose a lot of weight, even some inappropriate weight, maybe muscle weight. But once they stop with those methods, it's not livable and they don't have good hormone balance to maintain metabolism, energy. We all have in our bodies right now hormones that their only job is to maintain muscle or to build muscle or to lose fat, and we can use those hormones in the patient's care to help slim that weight off. We also use an amazing variety of pharmaceutical and clinical grade appetite suppressants, metabolic boosters to help people ramp up their metabolism and get that weight off for a short period, and certainly nutrition, and a lot of it is a lot of changing the plan as you go.
So Jennifer, thank you so much for giving us a great overview of all the wonderful services that you provide here at NuFemme. After the break, you're going to take us into the exam room, right, and show us a new treatment you're really excited about.
So we have the FemTouch Laser that's used for vaginal rejuvenation. It's changing a lot of women's lives, and it encompasses a variety of problems women in perimenopause and beyond come with, so we're really excited to show it to you.
Yeah, I'm looking forward to it too. So stay tuned. After the break, we'll go into the exam room. Dr. Feliciano was just telling us about all the wonderful services that you provide here at NuFemme. This procedure you're about to talk about is very exciting to have it here in our area and have it available to women. What do you like about this treatment?
The beauty of this technology is that it's the only FDA cleared device of its kind for women of all ages, childbearing and beyond. So if you have vaginal laxity from surgery or childbirth, if you have vaginal dryness or changes from menopause, or trouble with sensation or even pain during sex, even on to urinary leakage or incontinence, this will treat it. So the actual name of the instrument is AccuPulse FemTouch Laser by Luminous. It's a carbon dioxide fractional laser. All that means in lay people terms is it's a very pointed, specific injury to the tissue to rebuild it. So women ask me all the time, does it hurt? How much downtime do I have? And it's very, very limited. It's a painless procedure, and women walk out of the office, and so long as they aren't swimming or having sex for 3 days, that's it.
So you mentioned a number of different complaints that women have. What types of results are you seeing from this laser?
Well, women are seeing great results for this. If they have dryness, certainly in 1 or 2 treatments, that's going away, if not gone. The range is kind of 1 to 4 treatments, but most women, especially those that are on hormones, are starting with 1 or 2 treatments and their symptoms are gone within a course of a few days to weeks.
What about incontinence, for example? What are you seeing there?
Sure. So women come in with a variety of incontinence issues. Again, the less severe your symptoms, the faster your results. But even in the most severe patients, I have patients that are on multiple medications to help their incontinence, or they've had surgeries to try to repair it and don't get good results. Again, somewhere between the 2 to 4 treatment rule is really very effective.
What type of proof, scientifically maybe, are you seeing that this actually works?
Sure. So one of the best parts of this instrument is that it is FDA cleared, and there are multiple studies not only within the FDA, but outside of the FDA to prove that this works at a cellular level. So when women have dryness or pain with sex from hormone changes, or even urinary problems, or they have repeated infections or problems with incontinence, the cells change. So in doing these studies, the pathology actually shows the cells almost de-aging or regenerating to a point they were in earlier life.
What are people saying to you after having this? So you've got the scientific proof. Sure. You've got studies now that show that it actually works. But what do people say? What makes you feel good about offering this?
Well, of course, women, this is a big part of women's lives, and they want to be active. They want to not have to worry about their continence or about bladder issues. They want to be intimate with their partners. And every single one of our ladies say, if I would have known, I would have done this a long time ago. So it's a long time coming for women, and they're really excited about the results.
It sounds like it's quick too.
It's very quick. So, all of the patients that we have, we're actually doing a urinary tract infection and bladder continence study in our practice. 1 or 2 treatments, especially for the women with the more mild symptoms, is really changing them quickly.
Walk us through the procedure. How long does it take? Sure. You mentioned multiple treatments in some cases. Do people use an anesthetic?
Correct. So this is a completely painless procedure, which may seem difficult to believe with a laser, but as we talked about, we'll demonstrate that in a little bit. Women come into the clinic, and it's literally from start to finish, maybe a 15-minute procedure. The probe on the laser actually just fires in a circumferential fashion. Takes about 5 minutes, and they're up and out the door, back to work sometimes. So this is a really fast, painless procedure, and really most of what women feel is just this probe going into the vaginal canal. This is where the laser actually comes out, and you can kind of see it on your hand if you put your hand down there.
Yeah, right there.
It's very tiny, very small, very easy. Women just typically feel the probe turning. We have glasses on as a safety first.
So what you're demonstrating here is like, this is somebody's skin. This
vaginal
is the
tissue, right? The
okay.
tissue. And we'll fire it. You guys can hear it fire. You can kind of see it's very small.
Oh, right there.
It's very, right. It's
okay.
very shallow and it's very precise. If you can see those dots, those are the actual thermal injuries.
So there again, you see almost like a circle pattern. And so you might need to fire the laser
Correct.
internally a number of times.
Correct. So this is actually one of the most effective in covering that area. So a lot of the old style lasers were just one-sided and the operator would have to kind of guess. This is a very measured, very comprehensive coverage of the tissue, which is great. Believe it or not, I have women calling even within the course of a day and saying, oh my gosh, I'm lubricating. Oh my gosh, I don't feel like I have to use the bathroom as much. And it's really a very quick process. Certainly by about 72 hours to a few weeks after, women come back for their second, or even third treatment, and they say, it's a world of difference.
To learn more about FemTouch Laser Rejuvenation, contact NuFemme for a free consultation now through the end of October. Just give them a call at the number on your screen. It's 414-875-3833, or explore all of their medical services by checking them out online at NuFemme.com, and that's spelled NuFemme.com.